How is it that we find ourselves surrounded by such complexity, such elegance?
The genes of you and me, the genes of you and me, we're all made of DNA. We're all made of the same chemical DNA. We're all made of DNA.
Hello and welcome to DNA Today. I'm your host, Kira Deneen. DNA Today informs you on what's happening in the genetic world, shows packed news stories, lessons, interviews, all to keep you updated and educated on the ever-changing world of genetics. You can tune in every Monday, 11:30 a.m. to hear me live on WHUS.org. Or if you're driving around on campus, you can turn your radio to 91.7 FM. You can also listen to all episodes on DNApodcast.com. Now, our first news story here, I never thought I'd talk about them on this show, but it's about the Kardashians. The Kardashians reality show Keeping Up with the Kardashians recently featured the family getting genetic testing, which is why I'm talking about them on this genetic show here today. But there are quite a few things that either didn't make it into the show or gave false information about the process of genetic testing and what should be involved with it. So I'm going to kind of get into what the episode covered and what really should have been included that may have been missed. Now, the family was testing for hereditary cancer genes, as there's a family history of breast and colon cancer in the family. The grandmother on the show, Mary Jo Shannon, Kris Jenner's mother, and grandmother of the girls, Khloe, Kourtney, and Kim, has battled cancer, and now Kris Jenner wants to know if her daughters may be predisposed to the disease since that's in their family history. Now, in order to find out if they do have the genes that would predispose them to this disease, Kris had a conversation with her family about pursuing genetic testing and kind of opened the discussion. Now, the family did decide to do it, and they had blood samples taken at a photo shoot during hair and makeup, so before they actually were a part of the photo shoot. But it was still not the right environment to have this blood samples drawn and to be making this decision to go ahead with genetic testing. Genetic testing for hereditary cancer risk is a really important decision with a lot of pros and cons that really needs to be analyzed and thought about before going through with it. It's not an easy decision. There's a lot of levels to it that one should consider before going through with it. So it really should have been the main event of what they were doing and not kind of squeezed in, between doing their hair and makeup, and it's really not a light issue. So when the representative from the genetic testing company collected samples, they didn't fully explain what testing is available, the pros and cons of testing, or why they may or may not be good candidates for this testing, as not every test is appropriate for everyone. It's not like, I'm going to go for genetic testing, you send it to this place, they give you the results. It doesn't really work like that. It's really best to look at, sit with a genetics expert, such as a genetic counselor, and look at family history, as well as other things that I'll get into on this show. And this can help determine if genetic testing is warranted by sitting with that genetics expert, because in some cases it may not be. In some cases, going for genetic testing may not really help to learn more about a person's risk for developing certain cancers. And it's also a great way to learn which testing is best for you. If you are in a position where genetic testing can be beneficial, there are so many different types of tests and panels and different genes to test for that's a lot to consider when going through this process. So testing the right family member is also key. Testing each family member is not the best approach. It was said that the grandmother, Mary Jo Shannon, had breast and colon cancer, but not whether she was positive for a BRCA mutation. Now, Khloe, one of her granddaughters, did mention that BRCA at one point, but no one said if Mary Jo Shannon had been tested or not. And it's best to test the family member with the condition of interest if it's possible, as well as provide genetic counseling to them. So my question is, why test the person with a condition, right? That's probably kind of what you're thinking. I keep saying this, but what's the point? So testing an affected family member provides the most information about the genetic nature of the cancer in the family. It helps identify the gene they're looking for, because if you're testing the whole family, you don't really know exactly what you're looking for. But if you test the one person with the cancer and you find a mutation in them, you may go, this might be what's causing the cancer. And then you look at their offspring and even their siblings and say, do they have this too? And if they do have this, they could be at elevated risk for developing the same cancer or condition that the original patient had that testing. So that's kind of why it's the best setup for genetic testing, is really starting with that person that is affected, that affected family member. In some cases, it's not, because this family member has already passed on, and the family members of that original family member can still go through genetic testing, but it's really the best method to start with the affected individual if it's possible. So in the Kardashians' case, if Mary Jo was positive for BRCA or another gene, then her children, positive for a mutation that is, then her children, including Kris, could then be tested for that mutation. So you kind of go from generation to generation. If this grandmother was positive for it, then her children, so in this case Kris Jenner, could be tested for that mutation. And if Kris did not have that mutation, assuming the girl's father also didn't have the mutation, then the kids, talking about Kim, Khloe, and Kourtney, then they would not have inherited the mutation and would be negative. But if Kris was positive, then the girls could each individually be tested and see if they had the condition. Because if Kris was negative, there's no point in testing them if both of your parents are negative, unless you have a de novo mutation, which means a mutation that's not inherited, then they're not going to have that condition. They're not going to have that mutation. They could still develop the condition, but having a mutation that is associated with a cancer or a condition increases the likelihood of that developing. And testing multiple generations at a time was done in this episode, but it's rarely the most accurate scientific approach. Again, we're going for that first affected family member and going down from there if it's possible. Now, deciding to have genetic testing is a major decision and needs to be made with the right education and free will to say, do I want to do this? This is a personal decision. Now, Khloe, one of the daughters, was not interested in having genetic testing done, but was pressured by her family to do so. And this is a decision that really needs to be made individually. If someone really doesn't want to go through with genetic testing and they have all the information, they decide that for them this isn't a good setup for them, that they don't want to know this information for some reason, then that is totally fine, totally up to them to not have this. And if other family members want to do so, that's great too. But it's really a personal decision. And if someone is struggling to make that decision, they can learn more through a genetic counselor. But an important point I really want to make is that a genetic counselor will not and should not make the decision for patients, but just guide them through it and say, all right, here's the information. This is, if you get tested, here's the road that we may go on. If you don't get tested, here's different screenings you can do yourself and different risk reduction, maybe surgeries, and things like that, to really map out all of these ideas and see what options are for people and be educated in order to make this decision themselves. So even though she was against it, Khloe did agree to have genetic testing, but she was not properly educated. Again, this is so important to really know what decision you're making and what the implications may be. When she did have blood drawn for the test, someone explained to her that BRCA genes are associated with male and female breast cancer and ovarian cancer, as well as kidney, colon, melanoma, lung, and brain tumors. But then Khloe responded with, so either way we're screwed in dying of cancer. And someone responded with, yes. This is in no way true. If someone tests positive for having a mutation associated with cancer, it just increases the risk for developing that cancer. It is not a predictor of the cancer and is not diagnostic. So if you have a mutation in BRCA, that does not mean you are going to get breast cancer. It just greatly increases your rate to, in some cases, like 85% chance of getting breast cancer. So yes, those are very high odds, but it's not diagnostic. It is not a yes or no. It's a risk factor. It's statistics. Now, Khloe also could test negative for having this mutation and have no elevated risk above population level for developing cancer. This was not mentioned to her, that she's saying, oh, we're screwed no matter what, we're dying, which is not true, because if she had the mutation, she could not develop cancer, and if she doesn't have the mutation, she's at the normal population level, which is like 5 to 10% for developing breast cancer. So she is at no more significant risk if she tests negative, no increased risk if she tests negative for this. So no one explained to Khloe that the different and specialized options for screening and risk reduction for people who are positive for mutations. That there's risk reduction surgery such as mastectomies, more screening, so more MRIs and things of that nature to really catch the cancer earlier, that people may go through more of this screening compared to if you're at the population risk level. And they didn't stress the points that many people who are positive for BRCA mutations among other mutations live long, healthy lives free of cancer. So there is that subpopulation within people that have BRCA mutations that never get cancer. So it is not a death sentence to, have a BRCA positive mutation, because you could go your whole life and not have cancer. It's just really increasing your risk for developing that cancer and increasing it quite a bit. So after genetic testing has been performed, it's imperative for people to receive post-test genetic counseling. Now, Chris, Kim, and Chloe received their genetic testing results from a plastic surgeon who was a family friend. And Chloe asked if these results can change and was told no. So what's wrong with this picture? Why is this not the best setup for receiving the genetic results for the tests? Well, the family should have received their test results from a genetic expert. Again, like a genetic counselor, but there's also other people who have this level of expertise that can share this information with plenty of background education, and also who would have explained that a negative test result can be difficult to interpret. That just because you have a negative test result does not mean that maybe you don't have a mutation in there. We just may not know that that mutation exists, and really, if that mutation is correlated with the cancer. It may kind of be an unknown, and we say it's negative, but we're not actually sure if it does contribute to cancer. So while it's true that your genetic makeup doesn't change, advances in technology do, and testing options are constantly evolving. So when Chloe had asked, if the results can change, and she was told no by the plastic surgeon, who was a family friend, he really didn't answer that right. Testing options are always changing, and there's new panels, there's new those mutations that I just mentioned that instead of being identified as we're uncertain of what they do, uncertain of their relationship with cancer and other conditions, that what they're they could be not proven, but there could be data that suggests that it is correlated with it, and it could become something that we're uncertain about. An uncertain gene variant is the term. If that becomes if it becomes certain. So what were the results after all of this? The entire family tested negative for BRCA, so that's the gene that makes people more likely to have breast cancer, among a lot of other conditions, but breast cancer is the kind of most known to be associated with BRCA in the general population of kind of layman's terms of what people know. Now, that doesn't mean, again, that they'll never get it, but the chances are lower, just population level. Now, featuring genetic counseling on Keeping Up with Kardashians truly shows that keeping up with genetics is hard to do. And even with unlimited resources, it's been documented that in patients who do not receive genetic counseling, there's a high rate of misinterpretation and errors, that if a patient receives this information, they're unsure of kind of what it means, or they guess at things, and they don't have someone really explaining to them what it means and how things could change in the future, and that maybe they should be tested again in 5 or 10 years once technology evolves even further. Now, genetic counselors are your best source for full, accurate, and up-to-date information on genetic testing, so definitely check out. There's the National Society of Genetic Counselors. Lots of information on there. You can find a genetic counselor close to you and set up an appointment. If you think that maybe you have a mutation that is associated with a condition that you have a family history of, genetic counselors can really sit down and talk this through with you and see if there's a certain genetic testing that can really benefit you and your family members. If you want to learn more about this episode of the Kardashians, Mind Gene Council did an awesome review of it with their article titled "Sweeping Up After the Kardashians, What We Wish Had Been Covered in Their Genetic Testing Episode." So that's mygenecouncil.com. Now, I recently watched the film Sun-Kissed, One Gene Exposes a Nation's Dark Past, and this was a documentary. It's about a family who has children with an extremely rare genetic disorder that only shows up at the rate of 1 in a million in the general population. And for 15 years, Dory and Yolanda Nez thought that they were the only family on the Navajo Reservation who had children with this extremely rare genetic disorder, which is called Xeroderma Pigmentosum, also known as XP for short. That's how they refer to it through the whole film. And it's, again, very, very rare. 1 in a million. But the odds, as we learn in this documentary, is very different for the Navajo reservation, and the documentary takes you through the family learning about the disorder and why it has such a high prevalence in the Navajo population. So behind the closed curtains of their trailer, parked in the stark desert of New Mexico, they care for their 16-year-old daughter, Leandra. And just like her brother who passed away at age 11, Leandra was born with Xeroderma Pigmentosum. And this rare disorder makes any exposure to sunlight fatal. So obviously these kids need to be kept inside, and if they are outside, have their skin completely covered, and not just, with sunscreen or anything like that is not sufficient enough. They need to be covered with cloth, and kind of wear goggles, and it's a really, really scary and detrimental disease. And the film, filmed over 3 years with unprecedented access to the Navajo community. And the film, Sunkissed, follows Dory and Yolanda as they bravely confront long-held tribal taboos and question their rebellious choices of their youth, and kind of relate that to how those decisions may have caused the genetic condition of their children, and they kind of get into the mindset of that and their beliefs behind that. And ultimately, their journey leads them to a shocking truth. Their children, other Navajo children, are still paying for the price of an American conquest of the tribe in the 1860s, all the way back in the 1860s. And this was a brutal campaign culminated in an almost forgotten chapter in the American history, which is the Navajo Long Walk of 1864. And despite its importance as the defining moment in modern Navajo history, the beginning of their assimilation into American society, discussing the tragedy of the Long Walk remains a taboo topic within the Navajo community. So it's very hard for these parents that are looking for answers to learn about the Long Walk and why it caused the population to have a much increased occurrence of XP. And the relationship between that, because the elders did not want to talk about the Long Walk of 1864. And I'll get into kind of why that is and explore that a little bit more. And what Dory and Yolanda find changes the course of their identity and everything they believe in, really going it contrasts what they grew up with, and exposes a fresh perspective on the complex and cross-cultural identity of the modern-day Navajos. And it focuses on the continuing implications of American colonialism and the genetic imprints it has left on this community. So it really is, this film was great, and it presents a rare and realistic window into the issues confronting Navajo Americans today. And I'll just kind of pull out a couple things that I thought was really interesting about the film and the genetic aspects of that. And I thought it was interesting to hear how the Navajo culture impacts how they understand disease and live with it. So kind of their perspective versus maybe, someone from Connecticut. Now, the father says the reason his kids have XP was because he played with nature in ways he shouldn't play with, such as burning ants as a child, creating war by putting ants against each other, and someone else explains that their children's illness of also XP occurred because they burned a rodent, and when you take nature for granted, when you corrupt life in retaliation, it comes back at you. So I thought this was really interesting because in their culture, they believe that if you're messing with nature, then it will mess back with you in retaliation. It comes back at you, as the man had said in the film. And they really believe that this is a connection, that if you do something bad, you will be kind of punished for it by having your children have this disease. And in their culture, as I said before, it's kind of taboo to talk about certain topics, including diseases. So it makes it really difficult for the parents of XP kids to share with their own parents of what they're going through. Just having that emotional support system is just not there. And they believe that if you talk about it, then you're inviting it into your life. So the parents kept it to themselves. And they also believe that you should have a blessing in the Navajo way to help them get better. So if your child has XP, they say certain chants. And it's kind of a ritual that they show in the film and even open up with that. Now, a cultural rule to follow is to not marry within your clan, as bad things will happen to your kids. Now, this is something that just kind of, happened in the culture, and this is something that is kind of a cultural rule to follow. But scientifically, it makes sense because it may unmask covered traits if two carriers of XP had children. Because if XP runs more in one clan, then the carriers, if you marry outside of your clan and you marry a non-carrier, your children will not get it because this is a recessive condition. But if you marry within your clan and there's a higher population of carriers of XP, and you have two carriers together, you have a chance that your child may have XP because both parents are carriers and it's recessive condition. So if they receive that allele from both parents, then the child can have XP. Now, clans are considered closely related, even though there may be thousands of people in one. And the Navajo has 75 clans, and each person belongs to 4, depending on which ones their parents belong to. And as I said before, XP was linked to the Long Walk of 1864, and this is kind of the Navajo's Holocaust because the population went through a lot of hardship and a lot of death, and the population before this Long Walk was 20 to 25,000. But then, after the U.S. Army drove them into concentration camps and a lot of people died from diseases, starvation, among other things, the population went down to 5,000. And so it went from 20 to 25,000 down to 5,000. And now the resulting population today, that's alive today, is all descendants of these 5,000 people. And really less so because only a percentage of those 5,000 people were able to reproduce. Either they were adults or children that later reproduced, but the older generation of those 5,000 people obviously didn't reproduce. So less than 5,000 people started this population that we know today. And we all carry recessive genes, but if a group goes through bottleneck, which this population did, which means that the population was brought down, and if the people that are left over, if that population has a lot of certain genes, then that's going to appear more than it happened before. So we all carry these recessive genes, but if a group goes through bottleneck, the chances of the group to carry the same gene mutations increases. And this was information that was hard for the parents to learn about. As I said before, the older people wouldn't talk as they think it would harm them to talk about the desperation and just despair that was the Long Walk, and it was really hard for them to talk about, and they also believed that talking about it would harm them, similar to talking about diseases, that if you talked about diseases, it invites the diseases into your home. So that's something that was really a taboo topic that people didn't want to talk about. And at one point in the film, the father goes into a senior living community and asks people, could you give me more information about the Long Walk? I need to learn because my children have this genetic condition that we think resulted from the Long Walk, and that's why our population is so much higher with incidents of this. And no one wanted to talk about it, so they had to go to genetics experts and historians to learn about the relationship, which was difficult. So now that I've kind of talked about the documentary, which was awesome, definitely check it out. Again, the name of it is Sun-Kissed, One Gene Exposes a Nation's Dark Past. And now I want to kind of get into a little information about XP. I've mentioned that sunlight is a big contributor to this condition, and that if kids are exposed to sunlight or UV rays, that it is fatal. Now, the movie didn't go into a lot of detail and more focus on the lives of the family and the impact the disease had. So I kind of want to get into the clinical findings and the genetics and all of that. So the premature aging of the skin, lips, eyes, mouth, and tongue are all related to that UV exposure. And there's also neurologic degeneration in 20 to 50%, And there's different subtypes of XP. The most common is XPA and XPD. And there's abnormal speech, mental deterioration, or mental retardation, hearing loss, deafness, blindness, and increased incidence of certain cancers, especially basal cell carcinoma and squamous cell carcinoma. There's 1,000-fold increase compared to the population's level of developing these skin cancers to them. So really, it's a huge, huge risk. And if exposed to sunlight, I don't want to say they will develop it, but the risk for developing it is just astronomical. And for malignant melanoma, I said that, for basal cell carcinoma and squamous cell carcinoma, that's 1,000-fold increase from the population level. And for malignant melanoma, that's a 2,000-fold increase. So we're talking about huge numbers here. And cancers may be multiple. And median age of first skin cancer is only 8 years old. So usually patients of this condition are children, and the death is often due to metastatic skin cancer. Now, I mentioned that there's different subtypes of XP, and they're designated XPA through XPG, and XPV is also another one. And it's basically based on the body's capacity to repair DNA damage, and the body's just not able to do this as well as most people. And as I said before, the incidence is 1 in a million in the U.S. general population, but 1 in 40,000 in Japan, which I didn't mention, and 1 in 20,000 in the Navajo population. 1 in 20,000. That's very, very high compared to the 1 in a million in the U.S. population. That's because this population of the Navajos went into a bottleneck effect, that their population had a bottleneck effect during the Long Walk of 1864. And consanguinity is involved in 1/3 of cases, such as the Navajo population is seen in the documentary. Which I should have mentioned before, the parents of the main characters, really, that the documentary follows, were from the same clan. So it really increased their risk that they were both carriers, and they were both carriers, so their children had XP. And testing and diagnosis, there's no routine laboratory tests, but measuring the activity of DNA repair enzymes is something that can be done, and most diagnoses are made on clinical symptoms. So if your child's exposed to the sun and they start swelling up, that is a clinical symptom of having XP. And treatment and management includes avoiding sunlight, avoid use of retinoids that may help prevent some cancers. Use of retinoids that may prevent some cancers, frequent screening for early signs of cancer. And the summary was provided that I discussed earlier by bullfrogfilms.com. So definitely check out this film. Again, Sun-Kissed, One Gene Exposes a Nation's Dark Past.